Welcome friends, I'm Dr. Rajsree Nambudripad, and today's video is all about osteoporosis and bone health. Osteoporosis is a very common problem. It affects 200 million people worldwide. In the United States, half of Americans over the age of 50 have either osteopenia or osteoporosis. The word osteoporosis means porous bones. This is what a normal bone looks like compared to a bone with osteoporosis. There are many stages of osteoporosis. This diagram shows the progression from a normal bone to osteopenia, then to osteoporosis, and finally to severe osteoporosis. In osteoporosis, there's a loss of bone mass and defects in the bone microarchitecture. This makes the bones more fragile and prone to fractures. Our bones are the framework of our health. They provide the structure of our body, so having healthy bones is vitally important to maintaining our mobility as we get older, and it can also affect our longevity. Here we have a couple, Randy and Carol, who are in their 80s and living independently in their home. One day, as Carol climbs down the stairs, she slips and falls. This is the biggest fear in osteoporosis, that a fall will cause a fracture in one of the bones. Carol is rushed to the hospital and an x-ray shows that she's fractured her hip bone. Unfortunately, a hospitalization after a hip fracture is a big deal. There's often complications like a blood clot or pneumonia, and many of these people don't return to their independent life. They often end up in nursing homes, and due to the complications, there's a high risk of mortality within the first year of a hip fracture. Carol here is one of the lucky ones. She was able to return home to Randy and regain her strength with physical therapy. Another classic feature of osteoporosis is a loss of height. This is due to compression fractures in the vertebral bones of the spine. These vertebral fractures can also cause a person to become hunchbacked. This is called kyphosis, also known as a Dowager's hump. Now some of you may be thinking, isn't osteoporosis just a deficiency of calcium? Isn't it treatable by just taking more calcium supplements? Well, today I'm going to show you why osteoporosis is actually a lot more sophisticated disease. It's considered a metabolic bone disease, and factors like inflammation, the diversity of your gut microbiome, the integrity of your gut lining, your diet, hormones, muscle mass, and mechanical stressors can all impact your bones. In today's video, I'm going to explain how your bones are actually metabolically living tissues. They're dynamic and constantly changing, and how all these factors tie together, so stay tuned. Calcium is definitely not the only factor when it comes to your bones. Calcium intake varies throughout the world. In this map, countries shown in yellow and green have higher calcium intake, and countries shown in red, orange, and brown have lower calcium intake. But what's fascinating is parts of the world where the calcium intake is very low, like countries in Africa, people actually have very strong bones and they have a low rate of hip fracture. The same is true for many Asian countries. In fact, meta-analysis of prospective studies have shown that total calcium intake ranging from less than 500 milligrams a day to over 1,000 milligrams a day was unrelated to the risk of hip fracture. So clearly, there are other factors at play, and that's what I'm going to cover in today's video. The human skeleton has over 206 bones. We even have 6 tiny bones in our ears called auditory ossicles. The outer dense part of our bones is called cortical bone. The inner part of our bones, which is more metabolically active, is called trabecular bone. Within our trabecular bone, we have osteoclasts, which chew up old bone, and osteoblasts, which build new bone. Let's take a closer look. Osteoclasts actually originate from cells like macrophages, so they have multiple nuclei, and they work to chew up any old, damaged, or unused bone. Osteoblasts have a single nuclei, and they work to build new bone. In this delicate balance, who's going to win? Is it going to be osteoclasts or osteoblasts? So our bones are not static solid structures. They're dynamic living tissues. Bone remodeling is constantly taking place. First, the osteoclasts will chew up any old or damaged bone, and then the osteoblasts will build new bone. But where they build new bone is not random. They will put cells exactly where it needs to be, depending on the mechanical cues it receives. Unfortunately, this means if you're sedentary, the osteoclasts are going to think there's a lot of unused bone, and they're going to start chewing it up. Did you know that astronauts actually lose bone density when they stay in outer space? This is because the absence of gravity means less mechanical forces on the bone, and this cues the osteoclasts to chew up the unused bone. When astronauts return to Earth, they need to awaken their osteoblasts to help rebuild their bone. Remember, osteoblasts respond to mechanical cues. They need to be stimulated. Lifting weights and doing resistance training is the best way to stimulate your osteoblasts. Did you know that your muscles actually stimulate your bones to grow? Whenever a muscle contracts, it puts a mechanical force on the bones. Unfortunately, sarcopenia is the loss of muscle that often accompanies the aging process. As shown by these cross-sectional images of the arm, as we get older, there's a big change in our body composition. Muscle often gets replaced by fat. As we lose muscle mass, this means less mechanical cues on the bone, and it can lead to a loss of bone density. So when do our bones grow the most? The answer is during puberty. This is because of the surge in growth hormone that's released by the pituitary gland in the brain. Growth hormone promotes an anabolic bone-building pathway called the mTOR pathway. Growth hormone promotes the release of a hormone called IGF-1 from the liver, which promotes bone building. We reach our peak bone density around the age of 25 to 30. As you can see, after the age of 50, women have a more sudden decline in bone density, and this is caused by the sudden drop in estrogen that accompanies menopause. This is why osteoporosis is more common in women compared to men. This graph shows the decline in bone density in women with hormone replacement and without hormone replacement. As you can see, hormone replacement helps to protect the bones from the sudden decline we see in menopause. So clearly, our hormones impact our bones. Estrogen and growth hormone are good for the bones. Even as an adult, you can help promote growth hormone release by exercising and getting good quality sleep. Men with low testosterone are also prone to bone loss. If you suffer from hyperthyroidism, which is an overactive thyroid, or if your dose of thyroid medication is too high, this can cause bone loss. If you have overactive parathyroid glands, which cause calcium release from your bones, this is called hyperparathyroidism, and it can also cause bone loss. Finally, chronic elevation in the stress hormone called cortisol is also bad for your bones. In our body, our blood calcium level is regulated by two hormones, parathyroid hormone and calcitonin. We have 4 parathyroid glands, which are tiny glands that sit behind our thyroid in our neck. Calcitonin is released by the C cells within the thyroid. Parathyroid hormone works to increase your blood calcium by taking it out of your bones, and calcitonin works to reduce your blood calcium. These two hormones work together to keep your blood calcium levels in a very narrow normal range. This is why the blood calcium levels remain normal even in a person with severe osteoporosis. We can measure your bone density with a DEXA scan, which is a type of X-ray. The recommended age to get a DEXA scan is 65 for a woman or 70 for a man. However, you can certainly get a DEXA scan at any age younger than this if there's any risk factors or concerns for bone loss. The DEXA scan will report a T-score and a Z-score for your hips as well as your lumbar spine, which is your lower back. T-score is the standard deviations of your bone density compared to that of a young healthy person. In contrast, the Z-score is the standard deviations comparing you to someone in your age group. The scoring of the DEXA scan is based on the T-score, not the Z-score, so it's comparing you to a young healthy person. A T-score greater than -1 indicates normal bone density. Osteopenia is a T-score between -1 and -2.5. Finally, osteoporosis is a T-score that's below -2.5. Although the DEXA is a helpful tool, it does have some limitations. It measures your bone density, but it doesn't always correlate 100% with the strength or quality of the bone. It can also underestimate the bone density in women who are thin, smaller boned, or petite. Finally, genetics and race do play a role when it comes to your bone density. People of Asian descent have the lowest bone density, followed by white, Hispanic, and African Americans have the highest bone density. When it comes to your bones, vitamin D3 is critically important because it's required to absorb calcium from your diet. It's found in foods like salmon, egg yolks, and dairy products. Did you know that if your vitamin D is low, you'll only absorb 10% or less of the calcium from your food? You can also get vitamin D from sun exposure, but typically sunlight alone is not enough to get your vitamin D to an optimal range. It's also good to be aware that sunscreen blocks the production of vitamin D through the skin. Next, we have vitamin K2, which is critically important because it directs calcium to your bones and keeps it away from your coronary arteries. Vitamin K2 also helps stimulate osteoblasts and inhibit osteoclasts, so it has an anabolic or growth-promoting effect on bone. What's fascinating is you can get vitamin K1 from your diet by eating dark green leafy vegetables, and it's actually the bacteria in your gut microbiome that convert the K1 to vitamin K2. Some cultures eat fermented soy products like natto, which is also high in vitamin K2. So vitamin D3 helps you absorb calcium from your diet, and vitamin K2 directs the calcium to your bones. As you can see, your gut plays a huge role in all of this. Now I want to emphasize that dark leafy greens like kale, arugula, spinach, and chard are amazing for your bones. That's because they're a rich source of vitamin K1, and they're also a great source of calcium and magnesium. Now I want to talk about a few factors that can interfere with your gut's ability to absorb calcium. If you're on a proton pump inhibitor type medication which shuts down the production of acid in your stomach, this can affect the absorption of calcium and minerals, and long-term use has been associated with an increased risk of hip fracture. Certain types of bariatric surgery, which is done for weight loss, can also affect the absorption of calcium. Autoimmune conditions like celiac disease and inflammatory bowel disease, which includes Crohn's and ulcerative colitis, are also associated with an increased risk of osteoporosis. What's fascinating is research shows that people with osteoporosis often have a less diverse gut microbiome. Not only does the bacteria in your gut convert K1 to K2, studies have also shown that having more robust good bacteria, which are lactobacillus and bifidobacterium, it actually improves your absorption of calcium, magnesium, and phosphorus from your diet. This is why it can be helpful to take a good quality probiotic that contain these bacteria, such as our probiotic 100 billion or our probiotic 225 billion. Unfortunately, a lot of people suffer from a damaged gut microbiome. Exposure to the standard American diet, which has a lot of processed food, inflammatory oils, and sugar, can cause the overgrowth of bad bacteria in your gut microbiome. We call this dysbiosis. Exposure to antibiotics can also shift the balance of the bacteria in your microbiome. H. pylori is a bacteria that can infect your stomach and cause pain, gastritis, and stomach ulcers. Interestingly, a study done in Japan shows that an H. pylori infection is associated with an increased risk of osteoporosis. A lot of people suffer from poor digestion of their food, and this can be a risk factor for osteoporosis. Some of the root causes include achlorhydria, which means low stomach acid, low pancreatic enzymes, or maybe you've had your gallbladder removed. Small intestine bacterial overgrowth, also known as SIBO, or a parasite infection, can also affect your absorption of nutrients, which can then affect your bones. This is why taking a high-quality digestive enzyme can help you absorb more nutrients from your food. SIBO is actually a very common condition, and it presents with symptoms like gas, bloating, IBS, and altered bowel habits. In SIBO, bacteria from your colon have now entered your small intestine, and they interfere with your absorption of food. I have a whole video dedicated to SIBO, so if you're suffering from any of these symptoms, please check out the link below. Normally, the cells lining your intestines are tightly bound together by tight junctions. Inflammation in the lining of your gut, often caused by dysbiosis, can disrupt these tight junctions. We call this leaky gut, and it can allow food particles, bacteria, and viruses to readily enter your bloodstream, causing systemic inflammation, which is bad for your bones. I have a whole video dedicated to leaky gut, so if you'd like to learn more, please check out the link below. Did you know that your gut actually talks to your bones? That's because of the gut-bone axis. Fiber in your diet is metabolized by your gut microbiome into short-chain fatty acids, which are postbiotics. Studies in mice have shown that when they are given a high-fiber diet, as well as short-chain fatty acids like butyrate, their liver makes more IGF-1 and they have better bone density. Short-chain fatty acids are also key regulators of osteoclast metabolism and bone turnover. Did you know that prunes, which are dried plums, can actually improve your bone density? In fact, there have been numerous studies on mice, as well as 4 randomized control trials in postmenopausal women showing that prunes have a beneficial impact on bone density. Again, this may be due to the gut-bone axis. Prunes are high in fiber, so they feed the bacteria in your gut to make postbiotics that help your bones. Prunes are also loaded in powerful antioxidants called polyphenols, and they're a rich source of minerals like potassium, boron, and copper. They also have vitamin A and K, which can also directly help your bones. Inflammation in your body is also harmful to your bones. We can measure your inflammation using the high-sensitivity C-reactive protein on your blood work. Common sources of inflammation include the standard American diet, leaky gut, obesity, and autoimmune diseases. In fact, conditions like rheumatoid arthritis and lupus are associated with an increased risk of osteoporosis due to the inflammation. Autoimmune conditions are often treated with steroids, which reduce the inflammation, but when used long-term, they definitely increase the risk of osteoporosis. Chronic stress raises your cortisol levels, which can also be a source of inflammation. Finally, sugar can be inflammatory, and if your sugar is chronically elevated, it causes the production of advanced glycation end products, which accelerate the aging process and are bad for your bones. Many people don't realize that obesity is a state of chronic inflammation. In obesity, the fat cells enlarge and release inflammatory mediators. It's also associated with insulin resistance and a disrupted gut microbiome, all of which is bad for the bones. On the opposite end of the spectrum, if you're significantly underweight and have a body mass index under 18, this could also put you at higher risk of osteoporosis. Any sudden or significant weight loss can be bad for your bones. Women who suffer from anorexia often have an absence of periods. This leads to low estrogen that can weaken the bones. What's fascinating is that estrogen actually has an anti-inflammatory effect when it comes to your bones. Estrogen puts the brakes on a lot of inflammatory mediators, such as reactive oxygen species, interleukins, cytokines, and TNF-alpha. Unfortunately, when estrogen drops in menopause, it causes a lot of these inflammatory mediators to increase. This can accelerate the aging process as well as bone loss. Medications that block estrogen, which are often used for estrogen-positive breast cancers, unfortunately also have similar negative effects on bone. So does this mean you should go on hormone replacement therapy to protect your bones? Generally, we don't recommend going on hormone replacement just for your bone density. But if you have other symptoms of menopause, like hot flashes, then it may be worth considering bioidentical hormone replacement therapy, and you get the added benefit of it protecting your bones. To learn more about all the options for hormone replacement in menopause, please check out my video and I'll put a link in the description below. Now let's talk about how your diet can affect your bones. Unfortunately, the standard American diet is very acidic because it's high in processed carbs and meats that have acidic metabolites. Coffee and alcohol are also very acidic. Sugar and processed foods are inflammatory, so they're bad for your bones, and we call them bone saboteurs. Soda is especially a problem because it's high in phosphoric acid. The pH of your blood has to be kept within a narrow window. Unfortunately, your bone releases calcium and minerals to neutralize all the acidic foods you're eating. The calcium then gets excreted by your kidneys. This is why drinking soda or drinking excess coffee or alcohol can be so bad for your bones. An alkaline diet is good for your bones. The best way to keep your diet alkaline is by eating lots of vegetables and fruits. Remember, the dark leafy greens are powerhouses of calcium, magnesium, and vitamin K. You also want to include good fats from avocados and nuts. Wild fish like wild salmon also has calcium, and it's a great source of omega-3 fatty acids. So in my food pyramid, I recommend eating an abundance of vegetables to get all your calcium, magnesium, and K1. Then you want to make sure you're getting enough protein, because this is important for muscles as well as bones. I recommend a half a gram of protein per pound of body weight. So if you weigh 150 pounds, you want to eat 75 grams of protein per day. Finally, what can you have for dessert? Well, don't forget about prunes. They're kind of like nature's candy, and they're a promising functional food when it comes to your bones. I also want to mention that gluten sensitivity is on the rise. If you notice any abdominal discomfort after eating bread or pasta, this could be a clue that you're gluten sensitive. In that case, cutting gluten out of your diet can help heal your gut, which can help your bones. Now, what about dairy products? Are they good or bad for your bones? Dairy is definitely a rich source of calcium, but do you need to eat dairy to have strong bones? In 2020, there was a big review article published in the New England Journal of Medicine talking about the impact of milk on your health. This is a graph taken from the article showing various countries in the world along with their amount of milk intake as well as their incidence of hip fracture. What's fascinating is some of the Northern European countries like Norway, Denmark, and Sweden, where they have the highest milk intake, also have the highest incidence of hip fracture. In contrast, countries like Indonesia and China, where they have very little milk intake, also have a lower incidence of hip fracture. These findings are thought to be related to other factors, such as genetics as well as vitamin D level. Let me go over some of the pros and cons of milk. Milk is a rich source of branched-chain amino acids, which are leucine, isoleucine, and valine. This promotes the release of IGF-1 from the liver, which promotes the mTOR pathway, which is good for bone growth. For children with no allergy or sensitivity to dairy, drinking organic cow's milk may help improve their longitudinal growth and attained height. Now let's go over some of the problems with dairy products. A lot of people suffer from lactose intolerance, or they have an allergy or sensitivity to the proteins casein or whey, which are found in dairy. For some people, dairy causes gut inflammation and symptoms of irritable bowel syndrome. Because of all the hormones in dairy, consumption of dairy products is strongly correlated with the rates of breast and prostate cancers. Dairy can also aggravate allergic tendencies like eczema and asthma. Finally, dairy can be a problem for those with autoimmune disease because of the inflammation it can cause in the gut lining. This brings us to the interesting question of how do cows get their calcium? The answer is by eating grass. So a key point from today's video is that dark leafy greens are a great way to get your calcium, magnesium, and K1. Now let's talk about the relationship between sodium and your bones. Your bones actually serve as reservoirs for salt. So if your diet is excessively sodium restricted, your bones will start releasing minerals. It's best to use high-quality salts like Himalayan salt or sea salt. Drinking water with electrolyte powder is a great way to stay hydrated and to provide your cells with minerals like sodium, potassium, chloride, and magnesium. Certain environmental toxins can be harmful to your bones. This includes lead, which is often found in the paint of older homes and can get stored in your bones. Smoking is horrible for your bones. Not only does it expose you to cadmium, but it also causes you to break down connective tissue. This is why smokers get more wrinkles. Exposure to glyphosate and other pesticides can also be harmful to your bones. Finally, radiation treatments, which are done for various cancers, can also weaken the bones. Now, what about fluoride? Is it harmful for your bones? Fluoride is a very controversial topic, but in general, topical fluoride, which is used for dental care, may not be harmful. Systemic fluoride, which is put in the drinking water, is not good for the bones. and in children, there are also concerns that it can affect brain development. This is why I recommend drinking reverse osmosis water, which has all the chemicals and toxins removed, including fluoride. Now you may be wondering, what supplements should I take for my bones? That's a great question. Let's go over it. Vitamin D3 with K2 is critically important for your bones. You want to get your vitamin D level optimized to a goal of 60 to 80 on your blood work. Most of my patients have to take 5,000 IUs of vitamin D3 every day to get to this range. Be sure to take it after food because these are fat-soluble vitamins. The K2 in our vitamins is MK7, which is the preferred form of K2. Next, we have calcium and magnesium. The recommended amount of calcium is 1,000 milligrams to 1,200 milligrams per day. I recommend taking 500 to 750 milligrams from a supplement and try to get the rest from your diet. I also recommend 250 to 500 milligrams of magnesium per day. What's interesting is calcium causes constipation and magnesium moves the bowels, so they balance each other out. Typically, they're best taken in a 2-to-1 ratio, and you can adjust the magnesium to your bowel movements. Our calcium and magnesium are in the preferred chelated forms for optimal absorption, and they contain citrate to help bind oxalates and prevent kidney stones. I also recommend taking a high-quality multivitamin to get all the trace minerals for your bones, which include manganese, copper, zinc, selenium, boron, and more K2 in the form MK7. Collagen with hyaluronic acid is another high-quality nutrient for bone building. You can add a scoop of this to your coffee or smoothie. Next, I recommend vitamin C, which is essential to the formation of collagen within your bones. Omega-3 fish oil is also important to lower inflammation in your body. Finally, remember a healthy gut is critically important to absorb nutrients from your food. Taking a high-quality probiotic can promote a positive shift in your microbiome, and Digestive Enzyme Pro can help you better break down your food and absorb more nutrients. Now you may be wondering, what are the best exercises for my bones? That's a great question. Let's go over it. Exercises with impact put mechanical forces on your bones that help stimulate your osteoblasts. This includes brisk walking, running, dancing, aerobics, and stair climbing. Strength and resistance training using weights is the best way to stimulate your osteoblasts to build new bone. It's also a great way to improve your muscle mass. You can use free weights, weight machines, or even resistance bands. Yoga and Pilates can help improve your flexibility, your balance, and core body strength. All of this can help prevent a fall, which can help prevent a fracture. Squats are a great way to improve your strength and bone density in your hips and thighs. Lunges with weights are another great way to strengthen your lower body and improve the bone density in your hips. Using a whole body vibration plate is a great way to promote lymphatic circulation and to awaken your osteoblasts to promote bone growth. If you have any underlying injuries or pain, it's best to consult with a physical therapist for guidance before beginning an exercise program. What about prescription medications for osteoporosis? There are many different categories of medications, but the most commonly prescribed ones are called bisphosphonates. Bisphosphonates work by blocking osteoclasts, which normally chew up the damaged or old bone. Unfortunately, it's not without side effects. There's a risk of esophagitis, which is irritation of the esophagus, and there's a small risk of a very serious complication called osteonecrosis of the jaw that can be triggered by invasive dental work. They can be associated with atypical fractures, especially if they're used over 5 years. Finally, they won't work if your vitamin D is low. The good news is just through diet, lifestyle, and some key supplements, you can have a tremendous impact on your bone health and mobility. If you're sedentary and eating a standard American diet, you may end up looking like this when you get older. By maintaining an active lifestyle and eating an anti-inflammatory diet, you can maintain strong and healthy bones that can improve your quality of life and extend your longevity. Now I want to introduce you to one of my patients named Sue. Sue is a 68-year-old Asian American woman, and I diagnosed her with osteoporosis in 2020. These are her serial DEXA T scores for her hip and lumbar spine. Sue suffered from bloating and constipation, so in 2021 I treated her SIBO. Her bone density in 2022 didn't show much improvement, so she started an intensive strength training program. I was absolutely amazed when I saw her recent bone density showing that her T-score in her hip had improved dramatically to -1.3. So how did she do this? Sue used a machine similar to a leg press to put mechanical force on her hips to stimulate bone growth. This resulted in such an incredible change on her DEXA scan. Her bone density in her hip improved by 20% in 1 year. What's even more amazing is she did this without taking any calcium supplements because she suffered from a sensitive stomach. Sue also doesn't eat any dairy products, but she does eat a nice big leafy green salad every day. Sue's case makes it clear that mechanical forces play a key role in stimulating bone growth, and that dark leafy greens are an excellent source of calcium. So here are the key points. Osteoporosis is a metabolic bone disease. It's caused by an imbalance between the osteoblasts, which build bone, and osteoclasts, which chew up bone. Bone growth and remodeling is influenced by our hormones, inflammation, as well as the health of our gut microbiome. Dark leafy greens are an excellent source of calcium, magnesium, and K1. Key supplements for your bones include vitamin D3 and K2, as well as calcium and magnesium. Finally, strength training exercises is the best way to stimulate bone growth. Thanks so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. I look forward to hearing all your questions and comments, so please post those below. Thank you again, and have a wonderful day.